The ARTAS system has specific indications for use that include both harvesting follicles, creating recipient sites, and implanting the harvested follicles. When identifying patients for an ARTAS procedure, choose patients that have dark, straight hair and have been diagnosed with male pattern hair loss, also known as androgenic alopecia. The ARTASiX system includes several components. The system cart that houses the system's hardware, 7-axis robotic arm, and touchscreen user interface. The user interface used to control the ARTASiX system is attached to an articulating arm for easy use. The needle mechanism that houses the ARTASiX system's high-definition stereoscopic vision system, consisting of 2 cameras that analyze, monitor, and update parameters of each follicular unit 60 times per second. The ARTASiX system provides 44-micron resolution, that is about 1/2 the width of a hair. Before treating a patient with the ARTASiX system, it is important to ensure the patient has realistic expectations of their future hairline and the number of grafts to be placed. The ARTAS physician will have a consultation with the patient to review and establish these expectations. Together, they will determine the best location for a new hairline, how many grafts will be harvested, and where they will be placed. Here is an example of the ideal ARTAS procedure room. The procedure room should have all necessary items for the procedure, including graft preparation workstations, a sharps container, personal protective equipment, procedure stands, hair trimmers, barrier film, and beverages, snacks, and medications for the patient. ARTASiX enables minimally invasive harvesting of hair follicles in a precise, accurate, and reproducible manner. The procedure room is set up with procedure stands, various forceps, medications, local anesthesia, tumescent solution, the skin tensioner, tray and tool, swabs, graft coolers with petri dishes filled with a graft holding solution, and a spray bottle with saline. Once the patient is comfortably positioned and the skin tensioner is placed, graft harvesting can begin. Using the ARTASiX high-definition vision system and artificial intelligence algorithms, follicles are detected and dissected at a precise direction and angle with no guesswork. Once dissection of the grafts is complete, each graft is carefully extracted using a delicate technique to protect the integrity of each one. Grafts are then kept cool in specialized cooling towers until they are ready to be implanted. Graft preparation stations are set up with easy access to all of the items needed to prepare grafts for implantation. This includes microscopes, graft coolers with petri dishes filled with a graft holding solution, a spray bottle with saline, telfa pads, forceps, a blade for trimming grafts, a cutting board or tongue depressor, and a comfortable chair for the clinician. Here, a clinician will prepare grafts under a microscope for implantation. It is important to note that microscopes are a vital and necessary component of the ARTAS procedure. Contact your ARTAS trainer for a detailed supply list, including where to purchase microscopes. After grafts are prepared and sorted, the graft cartridges are filled. Grasping the graft from the top in order to protect the delicate area at the bulb of the graft, insert each graft into the cartridge. The filled cartridges are placed into a saline-filled petri dish. Individual fiducials are placed around the recipient area. The ARTASiX system uses these to track the area in which grafts will be implanted. The ARTASiX implantation procedure utilizes 3D preoperative planning with ARTAS Hair Studio. Using a photo that is taken of the recipient area, the physician prescribes a customized recipient area plan for their patient. ARTASiX graft implantation offers a patient benefits that can only be achieved robotically. The ARTASiX system scans the scalp, assessing each hair 60 times per second, identifies the existing hairs, and then avoids those hairs while implanting the harvested grafts based on the physician prescription. This is vastly significant to patient outcome because the final hair density will be greater if the procedure adds to the current hair a patient has rather than transecting or damaging it because it is not clearly visualized. The procedure room for implantation is set up with procedure stands containing gauze, local anesthesia, forceps that are angled at 45 degrees with smooth tips, large swabs, and a spray bottle with saline. The ARTASiX system uses the fiducials seen here to deliver precise and accurate incisions and graft placement simultaneously based on the ARTAS Hair Studio plan. During the ARTASiX implantation procedure, a clinician may gently adjust grafts as needed while the system continues to implant the harvested grafts. When the procedure is completed, the patient is prepared for release. Specific instructions are reviewed with the patient and a support person. The patient is instructed on donor and recipient site care, diet, medications, and provided the time for a post-operative appointment. At around 12 months, ARTAS patients see their new and improved hair reaching full growth.